Bizzibox's expert information on genital herpes. What is genital herpes?
Genital herpes will appear as blisters, usually painful blisters on or around the genitalia. It's caused by herpes simplex 2, so there are two main herpes viruses. Herpes 1, which causes cold sores and can be transmitted to the genitals, but it is relatively rare. Herpes 2 is more usually just genital, and it tends to cause a fairly unpleasant illness. People tend to become feverish and unwell and hot and achy, a bit like a severe flu-like illness. It's a nuisance because genital herpes will often recur, but genital herpes can be treated very effectively by using antiviral medication.
How do I get genital herpes?
You contract genital herpes by having sex with somebody who already has it. Now, people with genital herpes may not know that they have it, and they may not know that they have an active eruption. And it is possible, unusual but possible, to pick up genital herpes from somebody who is completely unaware that they've had it.
Can genital herpes be passed through oral sex?
Genital herpes can be passed around by oral sex, yeah.
Do genital herpes affect men and women?
Genital herpes will affect men and women quite equally.
What are the symptoms of genital herpes?
Genital herpes will often not cause any symptoms at all, but more usually, certainly with the first occurrence, it will cause the appearance of blisters, usually in a little cluster in a small point, often preceded by itch or pain or burning. They tend to be very painful indeed, so even clothing on the little collection of ulcers is difficult. And they often will cause what we call systemic symptoms, so they'll make you feel ill, headachy, feverish, as if you have a flu-like illness.
How do you test for genital herpes?
Predominantly there are two tests, or you can either take a swab directly from a herpes lesion and identify the virus directly, or there are some blood tests available which can be done usually around about 12 weeks post suspected contamination with genital herpes.
What is the treatment for genital herpes?
Treatment for genital herpes is straightforward in the sense that the medications are, they're clean, they don't cause too much in the way of side effect. The difficulty is that very often genital herpes will recur and you need recurring courses of treatment.
Can I resume a normal sex life after diagnosis of genital herpes?
You can resume normal sexual activity after a diagnosis of genital herpes. There is, unfortunately with genital herpes, there is an issue of possibly transferring it without knowing that you've actually got the lesions yourself. So if you are aware that you have a diagnosis of genital herpes, then it's polite at least to discuss with your sexual partners.
www.bizzibox.com